I was growing up, I always argued with everybody, right? And they said, someday you're going to be a lawyer.
And it's not meant as a compliment when you're a kid.
It doesn't.
They say you're going to be a lawyer one day.
I'm not sure it's a compliment even as an adult, but it is the thing that we're supposed to be good at, and that distinguishes us. We're not just there to neutrally unveil a set of facts, right? That's kind of more what an opening is. But I can't tell you how many closing arguments I've witnessed where there's no argument. They're just like rehashing the opening,
right,
or marching through the evidence that the jury's already heard. You do have to go through, you do have to marshal the evidence, but as Lloyd says, in the context of little bite-sized arguments that the jury can then take with them to help make your case for you in deliberations. I'm not 100% convinced that everybody's made up their mind by the closing in a malpractice case either, because I do think that's true in simple cases. I think, though, that in medical cases, again, they're complicated and jurors do struggle, right? I mean, they hear the very high-powered experts on both sides. They do have your framework from the opening in mind. Probably they're leaning one way or the other, but I think there's still room in closing to persuade people that some people may still be on the fence. I don't know. I don't have any data to support either view of it, but yeah, I think, and the closing should be fun for that reason, because you get to argue, and that's the fun part. And the arguments should be, they don't have to be just confined to stilted kind of lawyerism arguments. They can be arguments by analogy, arguments bringing in common life experiences, trying to like compare what they're seeing in this trial to something jurors have, daily experience dealing with in their own lives, in their own jobs, right? So I just think that and there's a lot of room for creativity with that.
Mm-hmm.
Because
give us some examples of what you do, Ben.
Well, I mean, we'll do some when I do my closing, but I mean, you talked about your stroke cases and the Drano and the analogizing that to plumbing. When I talk about one thing I do is I look at what everybody on the jury does for a living, and I'll often say, we have a teacher, we have a bus driver, we have somebody in food services, we have, and in your jobs, are there things you have to do that are there to keep people safe, right? Every one of you has that you have to deal with every day in your job, and you're held to those standards. Are we to believe that the only profession in America that doesn't have any standards that are there to keep people safe is the healthcare profession that's responsible for our medical care? Is that, So things like that. I just tried a case a couple weeks ago where it was a defense, accepting responsibility case. It wasn't a medical case, but I used an analogy which was, because this was a situation where they had gone 5 months and engaged in really horrendous conduct, and it only stopped when somebody found out about it and called the police, and they came in and shut this business down. So my analogy was, and I started by apologizing if I was going to offend anybody, which my wife tells me when I start something with that disclaimer, she starts to cringe. But anyway, so I said, I want you to imagine that you have a husband who's been cheating on his wife for 5 months. And one night, his wife comes home unexpectedly and finds her husband in bed with another woman. And he says to her, turns to her and says, honey, he says what the defendant says in this case, I accept responsibility. What does that mean? What it means is he got caught and he wants her to go easy on him. And that's when they say they accept responsibility, in this case, that's what they're saying.
I don't think I've ever heard them say, I accept responsibility in my cases.
Yeah, I mean, they don't usually do that. Or if they do, they give it with one arm and take it away. But so that's an analogy. Obviously, it had nothing to do with our case, but it's a way of trying to connect with jurors where they are. Of course, you have to be careful not to offend people. I talked to folks afterward, and people seemed okay with that. And, I don't think anybody was offended by it, but it kind of brings home the point. But we're free to do things like that in closing to try to bring home our points without having to be real stilted and just into the weeds of the case that is in front of them. So it's fun because you get to be creative like that and try stuff.
I worked with, do y'all know Jesse Wilson? You may have heard of Jesse Wilson. He does a lot of communications. He's from Juilliard originally, acting, professional actor, works in California, and now he works with trial lawyers. But to Ben's point about creativity, he worked with me. I've got another case, believe it or not, going to trial in January of another stroke, locked-in case, young woman, young mother, 2 little boys. And I worked with him on that case, and he does an exercise where you learn how to develop monologue and what monologue really means. And we worked on, speaking of creativity, we worked on Jennifer's case, and the monologue was a silent monologue because she couldn't speak. So we worked on this process where he had me sitting down, like Jennifer was sitting down, and starting off as Jennifer in kind of a locked-in state, unable to move anything except her eyes. And then we did this exercise where he had me get out of that body, be Jennifer, escape her body, and to demonstrate that she's still Jennifer. Her mind is still there. She's still the same person, complete cognitive function, just can't move her body. So we did this exercise where I basically removed my son. Jennifer got out of her body and was speaking to the world without the prison of her broken body. And she's like, I'm here, I'm still Jennifer. It's still me. Look at me. And then, expressing herself as she wants to be seen and heard. And then the exercise was to pull back. And she's like, I don't want to go back. And then she pulls back. And finally, she's back in her chair and she's again trapped. I used that in this past closing argument with Jonathan, who also has locked in, to demonstrate, to let the jury's mind kind of go escape and imagine, oh my God, it's horrible being locked in, but trying to invite them to see Jonathan as a real human. He's still Jonathan. And that was, with Jesse's help, very powerful way to kind of communicate that you see this broken person, the teeth push forward because his tongue pushes on the back of his teeth through a reflex, his jaw's forward, kind of looks, I told the jury this, I first met him, I was scared of him because he's scary looking. And anyway, but we talked to the jury afterwards, and they said that was very helpful to them to try to imagine, Jonathan as still Jonathan, even though he's in this broken body. So to your point, there's really no limitation on your creativity, but it's, we're lawyers, we're only so creative on our own, so you bring in people to kind of give you ideas and push you out of your boundaries. I never would have thought of this exercise without Jesse's help. He's a very talented guy. There are a lot of folks who can help in that regard, but anyway.
I can see that being very effective. I think that's kind of a version of a first-person close.
Exactly.
Part of it, you're going into the person and then coming back. There are cases in medicine where I think that is really effective because I had one where it was a 36-year-old kid who, it's the heart attack, they send him in the acute coronary, chest pain, goes to the ED, they tell him he has gastric reflux, send him home, and he dies a week later. But there was really no, he went to work every day, but no one really knew. And occasionally he'd say, well, I have some palpitations, I have chest pain, But we had no witnesses really to talk about what he went through over that week, other than just a couple data points. So what I tried to do in my closing, part of me, I moved into the first person, and I said his name was Wesley. So Wesley gets up in the morning, and now I'm Wesley, and oh God, my chest, it just really hurts. I'm worried about it. But I just went to the hospital and they told me I'm fine. But I don't know, am I fine? I don't feel fine, but I guess I'll just try to go, through my day. What else am I going to do? I go to work, So doing it like that, because then at least you can try to get a window into what someone's going through, even though there's really no, there's not a lot of evidence, other witnesses who can talk to that. But because medical stuff really is very private for many people. We go through a lot of anxiety. I went for a colonoscopy, right?
Tell us about it.
I'm not going to get into the details of it. I'm going to show you the animation in a minute.
Yeah.
But I went in there and they had my blood pressure. I was like 155 or something. And she's like, "Oh," I said, "Wow, that's really high." And the nurse said, "Well, no, that's perfectly normal. People are always anxious when they come in." I was like, didn't think I was that anxious. But then I said to my wife when I got back, I said, my blood pressure was high, and they said, "Oh, that's normal because you're anxious." And I said, "I didn't feel anxious." And my wife Sarah was like, "What are you talking about? You were anxious all week. There was you were talking about nothing else. You were like quiet. You weren't,
Yeah.
So clearly I was very anxious.
Yeah.
But medicine is private. We don't like to talk about it, right? So a lot of times you might need something like that.
Well, another point about closing is really important is to structure your closing around the jury instructions. Okay, because the juries are going, at least in Georgia, the juries get the instructions back with them. They get a hard copy. And that was one of the first questions this jury last week asked for. They all wanted their own copy. The judge sent back one copy, and then they each wanted their own set. They will follow those instructions, and it's very important to teach the instruction, because you don't want them back there, trying to argue and figure it out. Plus, you want them to have your impression of the instructions when they're deciding the case. So, for example, in Georgia, we have a gross negligence standard for ER cases. Horrible instructions. The jury's told that gross negligence is the absence of even slight care or slight diligence. So then the defense spends all this time, well, that was slight care, wasn't it? That was slight diligence, wasn't it? This kind of thing. Yes, horrible. But there's another piece of that same instruction, which they always ignore, which is it's also a gross departure from the standard of care. So you think in terms of quantity, and the way I explain it is preponderance is getting over the 50-yard line, clear and convincing, which is the standard to prove clear and convincing evidence of gross negligence, is getting in the red zone. And then end zone would be, beyond a reasonable doubt, which doesn't apply here. But you want them thinking in terms of quantum of negligence. It's a lot of negligence. You don't want them thinking this other bad definition. But you got to teach that. So I'll show that in my closing later this morning. We put the instruction up, we highlight the parts we want them to remember, and then we loop it back into the evidence so that they have some context for the instructions. That there's the liability instructions, and then we have our damages instructions, which we introduce in phase 2. But and then the jury's going to hear it read from the judge, and it'll reinforce it. So these concepts will start being familiar. And then you can also neuter or try to defang some of the positive defense instructions, such as the hindsight charge. Do y'all have hindsight charges, and where the judge says to the jury, you can't judge the conduct based on hindsight, basically. It's a very positive pro-defense instruction. So we want to attack it and go after it and say, all through the trial, well, this isn't based on hindsight, doctor. I'm talking about what the doctor knew at the time. Knew this. So just so the jury's clear, this is not hindsight. This is present knowledge that was available. This is what they knew. So you start defanging even before you get to closing, but then you get to closing and you teach the instruction the way that they need to understand it to put your case in a good spot.
Ben, based on your comment about overwhelming evidence,
Yeah.
do you argue the burden of proof instruction in the closing, or do you talk about it at any time in the trial if you think it sounds like you think you're wasting your time? You're either gonna hit them beyond a reasonable doubt, or whatever you want to call it, or you're not.
No, I mean, I do sometimes, and sometimes I don't. It's going to be case by case. But what Lloyd is saying, I agree with, in that jurors do want to follow the law. And, I mean, we've seen this many times in focus groups where if you teach them the burden of proof, there will be at least some jurors who will aggressively argue for it. And it is important. What I'm saying, though, is what I'm saying I don't think is inconsistent. I believe to win the case, we do need overwhelming evidence of guilt, but they also need to understand what the standard is that they're applying. What I'm saying is they're only going to apply that standard to find for you if you produce overwhelming evidence of guilt. They're not sitting there, because what they do in the medical cases is, if they don't understand it, and if it's just a competition of two experts that they both think are equally good and make valid points, you're not going to win your 51%, right? So you need more than that. That was my only point. But I do think it's still important to train the jurors on the law, as Lloyd says, and to have at least your good jurors able to argue that in deliberations. So what I wanted to just talk about kind of how I think about framing a closing. I don't know if any of you have read Mark Mandel's book on case framing. He's got a second book on it. I really like his approach to it. But the idea of it is that you have some overarching kind of universal principle that ties everything together, that fits together in a frame, that allows you to kind of assimilate all the evidence in your closing to make that overarching point. And a good case frame is something that's universally accessible, that's common experience in the medical, applies sort of across the board to. It's not your rules or even your kind of principle involved in your case, right? It's not you have to rule out a heart attack if someone goes in with chest pain. That's just that's kind of a case-specific rule or principle. This is kind of a bigger picture thing.
Give us some examples.
Well, so this is what so the way I think about case frames in medical malpractice is that we start with kind of what it's all about. And so I made this little diagram. You've got the doctor and a patient. And this is kind of the fundamental promise of medicine. I mean, medicine is about healing and treating disease, right? Making sure you don't get sick, or if you're sick, they make you better. And so the fundamental promise is that they care. They care about you. And there's a lot of indicia that supports or goes into the fact that, they're there to care about you. They have the right experience and training. They're going to listen to you and take time with you. They'll communicate with you. They'll order the right tests. They'll monitor your progress. They'll follow the safest course of treatment. Those are all things that when they do those things, what it tells you is that they really do care. And they're there for you. I will document the record accurately. Take the time to make the record right. And when they do those things, in response to them caring, you trust. We put our trust in doctors. As Josh said yesterday, we often take that leap of faith. If you're under anesthesia, you just have to trust. Well, why do you trust? You trust because they care. And caring isn't just an empty promise. The evidence that they care is their actions that show they care, such as these things and many other things, right? And because you trust your doctors, then there's things you do in response. You'll be open and vulnerable. You'll allow them to, do procedures on you when you're not there to protect yourself. You'll submit to testing and procedures. You'll follow their advice, even if the advice is painful, like you have to lose weight or quit smoking, right? And you'll pay them a lot of money to do these things. Money that might otherwise, be used for something else that you want to do and could put you into bankruptcy. So that's the medical system we all want to have. And everybody in the jury wants that medical system, right? But here's the medical system we actually get. Those are the things that are the basis for, that show that they care and that we have, we trust. But what you're going to do in closing is show that all of those things are a lie. They don't have the right experience and training. Now, not all of these things are going to apply in every case, of course. They don't listen. They don't communicate right. They don't under the right test. They don't monitor your progress. They don't follow the safest course. They don't document the record accurately. And when they don't do those things, now that they don't care about you. They're a threat to you. The medical care itself, rather than healing or promoting healing and curing disease, actually exacerbates your problem, makes it worse, or leads to problems that you didn't otherwise have. And when that occurs, we as patients feel betrayed by the system because we've opened up and been vulnerable. We've submitted to the testing and procedures, but there's no relationship of trust any longer. So to me, what this is the broken medical system. It's the system that we get unless we stand up and say, we're not going to accept this medical system. We want the other one. And to me, that is the case frame that every medical malpractice case is about. Fundamentally, right there. Every case should be about this in some form or fashion. It won't always have exactly the same, indicia of it, but ultimately that's how I like to think of the case and how I like to frame the case.
That's really good, Ben. And the piece of this that jumps out that lists the most is the communication piece, because that seems to be, of all the cases I've got, is the communication, the lack of communication, the lack of doctors talking to nurses, radiologists talking to ordering physicians. It's that lack of communication, and it's so easily understood by jurors how bad things can happen if you don't communicate. And you bring in the old game of telephone, which jurors will nod along because they remember it. When you pass along a message, you whisper in the ear, pass it along, pass it along. Just as an example of how communication can go off the rails and why it's important to, for people to talk to each other. And the electronic medical record has really compounded this problem because people want to communicate into the electronic record, not talk to each other. They just want to put their notes in, make it available to everybody, and then move on. People don't talk anymore. The old days, doctor would order an imaging study, go down to the radiology suite, put the image up, talk with the radiologist, review it, discuss the condition. Radiologists can be 50 feet down the hall and may never see a doctor. So it's the communication piece that I think just pops right out because it kind of informs the rest of these. The monitor your progress carefully. Well, a lot of times that's because one doctor is not communicating with the nurse, or the nurse is seeing concerning vitals, doesn't communicate that to the doctor. But so one of the frames is you got to talk to each other. People have to talk to each other. Another great frame that I know you use and I use a lot is do your job. Everybody has a job to do. And if you can demystify this medicine, all we're really talking about are people doing a job. So, a doctor has a job, a nurse has a job, do your job. It's a very powerful frame that's universally accepted among people.
Yeah, and I think almost every case has sort of an for me, every medical case, the overarching frame is we have a broken medical system, and the only way we have a better one is if people demand better, because otherwise we're just going to keep getting this. But then underneath that, there are subframes that relate to different parts of what happened, such as people aren't doing their job, people aren't talking to one another. And I mean, every case, you're going to have the core medical piece of it. What were they required to do, when, and what difference did that make? But outside of that, you're going to find a lot of, I mean, you saw it in Lloyd's opening the other day. How many different things were there that they didn't do? They didn't follow multiple policies. Nurse doesn't call the doctor. So it's, and some of those things are going to be directly germane to the kind of core issue, and some of them are going to be a little bit ancillary to it, but it's still powerful evidence of the going back to we just don't care, right? The medical record, let's say, here's an example, you see the charting and it's clearly just cut and paste every day. It's the same thing, even though the conditions are clearly different and the clinical status is different, but certain provider just like the same boilerplate charting every day, right? That might not ultimately be what makes the difference in your case, but you're going to point that out because it's an indicator that the system is broken. They don't care enough to get it right. And in almost every case, you're going to have a dozen or more of those kind of things. Mm-hmm. But it creates a picture of a system that just, that isn't set up to care about the patient. And that's where I get to the sort of overwhelming feeling you have to create about what's going on here. It's more than just a single incident that they made, an honest mistake. It's more than that.
Well, let's talk about the hardest part of closing argument, asking for the money and the damages model. Ben, why don't you kick us off and tell us how you asked for money, how you set that up, and then I'll share my thoughts on it.
Yeah, I mean, it's different in every case, individual to what's happening. But what I like to do is, first of all, I like to condition them in voir dire if we have the opportunity, depending on where the case is tried, to kind of where we're going to be with this. And then again in the opening. So by the closing, it won't be news to them, kind of where we're going with it.
So you've already asked your number.
I've always put the number out there. What I like to do though is I like to break things down and to talk about the different elements of damages, and not to kind of, there's what someone has already experienced in the past. That's different from what they're going to experience in the future. So generally, depending on the age of your client, you're talking about decades or a long time, and you're reminding the jury that they're going to be living with this every single day for the rest of their life. But